I wanted to start with a quote that I like. I don't know if any of you know of Rachel Gutter at the Green Schools movement in the US. She's a really dynamic speaker. But she said, changing the world is always disruptive. And so I just want to ground this presentation in that. I've always found that to be the case. I'm excited to talk about it today. From my own experiences, absolutely, leading change in times of disruption, but also from what I've learned from the experiences of others that I've come into contact with who are changing the world. And I'm going to start by talking about a visit to a photography exhibit. But I'm going to set up the context a little bit. Brief history. I was hired into my role in 2012, and it was a year after the Auditor General of Ontario did a report on the Ontario Trillium Foundation that questioned, among other things, the value for money that we were providing. And the board, in hiring me and the committee, had conveyed that they really wanted to have a changed leader, someone who was going to increase the profile of the foundation, try to demonstrate the impact that we were having on communities across Ontario, and certainly able to demonstrate the value that we had. So fast forward then to 2014, in the winter. OTF's now mired in the middle of trying to figure out this new strategy that we coined Redesign 2015. It was going to be the first major overhaul of our granting process in 15 years. It was looking forward rather than back. It was focused on what we called our $1 billion challenge, which is if we're going to invest $1 billion in the next decade, what do we want to see for that investment? What are we hoping to accomplish? It was about both what we fund and how we fund it, focusing our efforts in ways that we hadn't before. And now that it's somewhat behind us, I can share with you that there were many, many internal disagreements on how we were going to do that. There were disagreements at the staff level. There were disagreements with our volunteers who are public appointees. There were disagreements at the leadership level and at the board level. And at one point during a particular contentious meeting, one board member said, you know, everything was great before. It wasn't broken. I don't understand why we have to fix it. And another board member retorted immediately and said, if we wait till it's broken till we go to fix it, it's going to be too late. And that conversation happened all over the organization. Different words, but that was the same thing. So at that time, I thought, you know what, I think we need to shift outside of ourselves a little bit and think about this in a different way. Try to get our leadership team to think differently about the change that we were looking at. So I took them to the Image Center at Ryerson University, and they had on a photography exhibit called Disruptive Innovation. And it told the story of the demise of Kodak, which in 2011 filed for bankruptcy. So anyone heard of Kodak before? So it was really quite ironic, actually, because the story was told through old film photography. So it was sort of this irony being there. And of course, many of you know the story. I mean, they had 90% of the market share of the business in their heyday, but they failed to adapt to the reality of digital photography. And this despite the fact that in 1975, they actually invented the first digital camera. But the executive team said, you know what? We make so much money in film and printing, we don't want to go down that route. And so even 10 years later, Sony then comes up with a digital camera, and they still say, well, okay, I guess we can catch up now. But they still focus their efforts on, here's how you print your digital photos. They didn't get the whole world was changing around them and that was really, really what they needed to respond to. So when smartphones became the norm, they no longer had a customer base. So post-viewing this exhibit with my team, we had a facilitated discussion. And in the discussion with the group, there was a couple of ideas that I found fascinating. One is that Kodak did have that idea, the same one that had been mentioned at our board table, which is, if it's not broken, why fix it? Kodak was a leader in their field. They didn't need to make a better film or a better camera. They needed to recognize that the needs of their consumers and the environment around them was changing. So at OTF, we took a lot from that example. How might we think about the future differently so that we aren't left behind, that we're not stuck in old models and old paradigms? Seeing an example of an organization that wasn't us, that failed to keep the pace of change, it helped the penny drop in our team a little bit. And that often happens when you hear about other examples, and I'm hoping today, maybe by sharing some of my own, a penny will drop for you. And it's hard when you're in organizations to see it sometimes. At OTF, we didn't want to wait until something was broken before we went about fixing it. We didn't want to be reactive. We wanted to, in fact, be proactive in leading change. And Kodak's moment served as a reminder for us that the transformation we were going through wasn't about fixing a problem. It was about trying to use our considerable strength to create a new future, and one that by design was strategic and ambitious. So, idea number one, there is a huge difference between leading change and managing change. And I want to start with the personal because leadership is absolutely personal. Not everybody is a change leader. Are you the disruptor, or are you in fact trying to deal with the disruption that's happening? We actually need both in organizations. But it's important that as leaders, we are aware of our own tendency and what we are better at. When I look back at my professional experience, disruption and change have been a common thread throughout. Early on, I learned that I thrive in changing environments, and I've been drawn to working in great organizations that are actually doing well, but that with some transformation can reach even larger goals that people previously thought were impossible. And in fact, when I left my last gig at Unison Health and Community Services, we'd gone through a number of changes, mergers and amalgamations and expansion and growth, and our board had said, we really want to stabilize. We don't want to have any more change happening. We think it's really, really important to kind of just stay the course. And I realized, you know what? They need a different leader. That's not the leader I am. They need someone who's the steady Eddie, and that's okay. So what's the difference then really in terms of whether you're one that wants to lead change rather than manage change? I think it comes down mostly to mindset. So mindset A I would describe as opportunistic, having that sense of possibility. Figuring out, are you the one that wants incremental improvement, or do you want to have a complete system overhaul? Are you comfortable with the acceptance that you will fail at some point and that failure might be public? Do you have a tolerance for risk? Although I always hate to pose that question because there's an implicit assumption then that somehow doing nothing isn't risky. And as we see from Kodak, it was absolutely risky to do nothing. In fact, Roger Martin of the Rotman School had something to say about that, and I use it quite a bit, which is that the status quo gets away with bloody murder. And so it's always in the background of my mind. So let's flip to mindset B then, I think, which is the other one. People who are change managers want to optimize what's already there, which is great because we absolutely need that in the organization as well. They're great change managers, they're great implementers of the change that's happening. But sometimes there can be a tendency to go towards a scarcity mindset. And I'm a funder now, so I feel like we hear the scarcity mindset all the time because organizations always have needs for more, right? We need more time, we need more staff, we need more resources, we need more money. And it's not just our grantees and our applicants, it's also internal in our organization. We all have folks in our organization that we hear this from. And I'm from healthcare, so this is like the mantra of healthcare, right? More, more, more. And in fact, currently in the news, there's the federal provincial negotiations on health transfers to the provinces. And I feel like I'm listening to the same conversation I listened to 10 years ago, quite frankly. The fact of the matter is, for many years, there was more money. But you know what? It didn't do anything to move the dial on how we were doing in healthcare. It really didn't. When I worked in community health, I wanted to be there because I was attracted to making sure that people got access to the care they needed and the drugs they needed. We were in a population that had some significant challenges. And in our organization, despite our best efforts, we had patients that often had to wait for a month to get an appointment with a primary care provider. And we had this convoluted system of how we did urgent appointments that was like quasi-effective. But for a lot of our patients, it was a huge concern because many of them were non-insured. They had nowhere else to go. So this became very important. We thought if we had more doctors and nurses, we could just solve the problem. But from time to time, we found extra money and we'd, sort of hire up and we'd put folks into place. And the wait times didn't change. And so we thought, okay, something else is going. It's not about the money. It's not about the more. It's about a systems overhaul. And so we found a novel solution that was referred to as advanced access. And we didn't think of it, it's not my creation, but we did adapt it and take the idea. It was designed by one of the larger HMOs in the States, actually. And it was designed after a just-in-time delivery system that Walmart used. Now, I'm not here to speak to you on the issues of large chain retailers or any of the, the things surrounding that, but for those retailers, inventory control is a huge issue, right? Because they don't have a bunch of excess storage capacity, so they can't just store things if they come too early, and they want to make sure that their shelves are stocked. And those of us who remember why Target failed in Canada, it's because there was nothing on the shelves, right? So that's sort of the inventory control. So the premise of it, though, was that people should be seen the same day they call. Because when they call, that's when they're sick. They're not going to be sick in a month. People don't predict their illness, right? They need to be seen when they call. And so, in fact, if you study your demand, you can then start to predict it. And then you can schedule your clinical staff around when people are more likely to seek care. So we know, for example, more people seek care on Mondays than on any other day. And yet we had our staffing that worked the same number of hours every single day. So there was a mismatch. So this was my first foray into data-driven decisions, and I haven't let it go ever since because I was really convinced of how this could work. So we launched it. This huge change initiative. And in fact, it kind of worked, but we needed to iterate and improve based on our experience, and we ended up having to actually go to an adapted model. And the reason for that was, the clientele that we served, many of them didn't speak English, and many of them had mobility issues that required transportation. And so patients would call and say, need an appointment. Oh, can you come in today? Well, they need to book an interpretation. They need to book Wheel-Trans. And those of you who've tried to book Wheel-Trans, that is not a same-day service. So we had to do a bit of a hybrid model. Two important learnings from that for me. The first is that we need to really challenge our assumptions and change the system sometimes to solve the problem. It's not about just more of the same way you do things. It's about freeing your minds from just trying to improve the status quo. In fact, Aerosmith has a song, Get a Grip. Not a huge rock and roller, but the lyrics are, because if you do what you've always done, you always get what you always got. And I think that's true in this case. The second, though, learning from this is that disruptive ideas can come from unusual places. And the trick is to be able to borrow and adapt ideas to your context. Most people in healthcare don't look at Walmart to get their best ideas. But in fact, that was the push in thinking that allowed this model to be developed and was really, really effective, and I think is still operating to this day. And that transitions perfectly into the next idea, which is reaching beyond the usual suspects to find disruptive ideas. Every sector, including the not-for-profit, tends to be insular. And yet, we know that most innovation happens at the intersection of people coming together. So, like the advanced access example, cross-pollination of ideas is what can lead to breakthroughs from thinking. In the last few years, the concept of collective impact has emerged as organizations in all sectors try to look at how they can contribute to social good. And the concept, for those of you who aren't aware, is about working together differently in situations where you have a complex social issue that's sort of been resilient to change over time. And it's a methodology that brings people from all different kinds of spaces, the private sector, funders, governments, not-for-profit people, people who are impacted by the change that you're seeking, to work in a different way to achieve change. So with our new granting strategy, OTF really wanted to invest quite deeply in collective impact. But to be honest, we're having trouble finding projects that are ready to go. In our other programs, we have, $7 requested for every dollar we have to grant. And in collective impact, we can't get the money out the door for what we set aside. And we see lots of collaboratives with not-for-profits. We see sometimes with the service recipients. We see sometimes with the public sector and others. But most of them are having difficulty getting the right grouping of people around the table to be able to solve the problem. And we don't often see the kinds of relationships with the private sector that we need to see, or with other, what I would call unusual suspects, people who we don't already have on our Rolodex, right, and on our contact list. And as a sector, we're not practiced at this. I think it's a lot more comfortable to sort of seek the comfort of our own echo chamber, and that's actually, unfortunately, not what's going to solve the kind of problems we aim to. And so for us to be able to find disruptive innovation, we need to reach beyond our bubble. Now, many of you might be familiar with Bill Young's work. Yes, okay. So it's a demand-side employment and looking at, rather than having an employment agency that's teaching people how to use Microsoft Office, and here's how you do a resume, and here's some skills that you can use to do an interview, look at instead, what do employers need? And how do we then feed it from the other side? And one of our recent collective impact grants, actually, that we just announced, was with Mars and Starbucks, and looking at, in fact, how can large employers help to solve this problem? Because the not-for-profit sector is probably not the best position to solve the problem. It's the private sector that is. And they can use our help in doing that and getting skills ready, but we're quite excited about what that might do. In fact, another one of our early collective impact initiatives that was about unusual suspects was to the College of Family Physicians. And it wasn't we don't fund anything in healthcare, actually, so it was a bit of an unusual grantee. But they were looking at early literacy. And their sort of innovation was to say, the problem with the preschool age kids is that who's in their lives? Well, physicians and primary care providers. They're the ones that actually can detect the problem. They can work with parents to encourage early reading. They're the ones that have that regular contact. So why don't we use something that already exists in a different way from which it's been intended? And so we're quite excited to see what that might do. Often we overlook sometimes where the very best innovations have come from, and that's from involving people that we seek to help in a design thinking approach, right? And looking at how we use the perspective of the recipient to truly understand the problem we're trying to solve. And that can also lead to innovative solutions. After all, understanding the problem undermines most of the disruption that happens. As Einstein said, if I had an hour to solve a problem, I'd spend 55 minutes trying to figure out what the problem was, and then 5 minutes on the solution. We often jump too quickly to solution, and that can create what's referred to as this functional fixedness. And that's a cognitive bias. It allows us to overlook solutions that might be in plain sight. So in a recent Harvard Business Review article, there's something on innovation. I think it's on my list. It's McCaffrey and Pearson. And they use the example of the Titanic to describe this functional fixedness. And I really kind of like this story. Everyone's heard of the Titanic, right? Even the Leo DiCaprio starred in a movie. It was really good. Okay. So in 1912, the Titanic collides with this iceberg. And only 705 passengers out of 2,200 survive. Pretty devastating. 60 years earlier, there had been an almost identical disaster, and yet they saved everybody. And how did they save everybody? The ship actually pulled up to the iceberg, and people waited on the iceberg to be rescued. In Titanic's case, though, the iceberg was seen as the danger. It was seen as the problem. And so what the ship did was to get away from the iceberg as fast as they possibly could. And it was a clear mismatch between what the problem was and what the solution was. The lifeboats could have ferried more passengers to the iceberg. The ship could have pulled up to it and almost lodged itself on top of. But our assumptions of what the problem is blind us to the obvious and prevent us from recognizing future threats and opportunities, ultimately preventing our success. In the Titanic, the problem was actually to keep people afloat. That's the problem they needed to solve. Because if they could stay floating, they could be rescued. But they misinterpreted the problem as being the iceberg, and that's where everything went wrong. Which brings me to the third idea, which is means versus ends. Now, this is not about the Carver governance model. Any of you who've sat through any of those, that's a very boring presentation that I'm not about to give. Okay. But if we think about the best known disruptions, Uber, for example, the problem to be solved hasn't changed. People need to get from A to B. That's what they're doing. They're not doing anything other than that. The solution is about the means, or the how that happens. So not relying on traditional taxis or professionals, but instead using this ride-sharing economy. Everybody's aware of that. In my earlier example of advanced access, the ends had not changed. The problem we were trying to solve is we needed timely access to a physician. Nothing about that problem changed. What changed was the way in which we got there. In my experience, though, people think of disruption and innovation as a complete transformation and blowing everything apart. And it certainly, as Elizabeth said, has the power to be transformative, but it's not always transforming what it is that we want to accomplish. And particularly, I think in the social sector, the ends are going to be the same. We still want to reduce poverty. We still want to make sure people are healthy. We still want to make sure the environment's okay, right? Those ends are the same. It's the way in which we work on the means that's going to actually cause the innovation to happen. So at OTF, our major shift in thinking has been around what we consider the problem versus what we consider the solution. In the past, we always looked at the problem being one of organizational capacity. So if we give funding, organizations will therefore have more capacity. and then therefore the problem is solved. The present is that people are actually at the center of the problem that we're trying to define. And not that the people are the problem, but it's about our action area level outcomes, right? What we're trying to solve for is about people. Organizations are a means to get to the result that we want to see. So, as an example, in 2010, if you were a sports and recreation organization, call you Organization A, and you wanted to get people more active, you might apply to us for a strategic plan. Because we have this whole theory, well, if we fund a strategic plan, obviously it'll be successful. In 2015, the problem's not that you need a strategic plan, the problem is that people need to be more active. And then how you go about that is sort of the means. I have to tell you at OTF, we funded tons of strategic plans over the years, like thousands and thousands of strategic plans. And I'm not sure, at the end of the day, whether it made any difference to people on the ground. And that's what we're trying to solve for now. What is the difference it makes to people on the ground? So we hope we can fund the means in a way that can seed innovation and can help it grow, but it's not the point. I had the privilege of being a judge for the Enactus Cup this year, which was in Toronto, Ontario. And it changes location every year, so it was kind of neat. It was in Toronto. And they're an international organization that seeks to inspire students to use entrepreneurial action to make changes in the world that will make the world better. And if you ever want to feel good about the next generation, you should really go to one of these events. It's quite uplifting. And this year, Canada won, so that was really neat. And I was, actually, I got to judge one of the ones that Canada was in, and I wasn't biased at all. They really were great. But they had a project that was looking at how do they address food security issues in northern communities. And traditional solutions or means have involved supply chain, how to get food more cheaply up to those communities, usually via air, right? And there's been a lot of stuff in the news over the past few months about how well or not that system has been working and how people have profited, and there's all sorts of issues around that. So they took a different approach, though, in terms of the problem that they were trying to do. They looked at the problem in a different way and said, well, never mind trying to get stuff up there. What if we can have communities create food and then be self-sustaining in their food? And so they partnered with botanists and engineers, and they were able to develop this low-cost, environmentally friendly hydroponic system to produce high-quality fruits and vegetables year-round. Community members then in the north bought into these systems. Some of them created these community, collectives that would grow food for the community. Others started small businesses and then actually was able to contribute to the economy. And in fact, this year, the systems are going to grow 72,000 pounds of produce in northern communities, and it's only their second year. Like, it's really quite an incredible story. And on top of this, they actually then employed hard-to-reach youth to actually build them. So, just as a side benefit, because they weren't busy. So the problem that they were trying to solve, which was the access to fresh food, was no different in the new system and the old system, but the way that they thought about solving it, which was the innovation. Now, of course, if this takes off, the traditional food distributors are going to be a little bit annoyed because that's a significant chunk of business for them. And all disruption, we know, has winners and losers, which takes us to the fourth idea. Be mindful of those who benefit from the status quo. I've learned if we try to do everything, we'll accomplish nothing. But effective strategy does make choices that may exclude those who are currently privileged. So, as first example, as was in my introduction, I've been involved with the International Planned Parenthood Federation for more than a decade. And this venerable organization recently celebrated 60 years. And in fact is not really well known, but they're actually the second largest international NGO, second from the Red Cross. They'll have different names in different countries, so people don't recognize that. So it's very impressive, but it also means they're quite a large bureaucratic organization, and change doesn't happen very quickly. It's not what I would describe as an agile organization. And they have growing needs and shrinking budgets and what can only be described as a politically adversarial environment. And so there's many drivers for change. And two of the major initiatives that I had been working on with them had been a move to performance-based funding and shrinking the cost and size of governance. I quickly found out that both of these initiatives are not what you want to do if you want to be popular. So When I started over a decade ago, we had a governing council that was 30 members. It was honestly like a mini UN. We had 5 members from 6 regions, and they all came to the table and, sort of this big square, and we have French-English translation, and we do 3 days of meetings. And our government funders were really pushing back on us to say, the cost of that governance model is too high. You just can't do that anymore. But I thought, okay, well, we'll change the system. We can make it better. We don't need to sort of operate that. I was very naive way back those many years. What I didn't really quite capture is that many of the governing council members got real status from being seen. I mean, in Canada, no one really cared. What's the organization? Or, is that fertility? No one really knew what it was about. But in some of the countries where people were coming from, they actually got a diplomatic passport. It was it was a big deal for them, and that status mattered. And so they didn't want to go. And so what happened, in fact, is that there was a slow reduction in the size of governance over a 10-year period. So the first move, which took 3 years, was to go from 30 to 24. And then next year, they're trying to go from 24 to 18. And in that way, existing members could just go at the end of their terms and no one had to leave early. Now, for someone who wants to make change quickly, that's an extraordinarily frustrating experience to be in. But what was more frustrating was that at the same time we were trying to implement then this performance-based funding model, which would mean that future funding, a portion of it that would increase every year, would be tied to country performance. And so that those who actually delivered more services, got better outcomes, would have a better share of the funding and trying to incent our high performers. So this was super news for those who got more. And there were many that got more, and they were thrilled. That was great. Thank you, we're finally being recognized for our great work. But for those who lost funding because they couldn't show impact, they did not go quietly. They were far more vocal and far more adversarial than the ones who were happy. Because they had been getting funding at a certain level, they were therefore entitled to it. And it's often the case that the winners are not as loud as the people who aren't. So fast forward a few years to the OTF strategy implementation. I would say that when I started, I heard this anecdotally, but it came up in some of our surveys. There was a perception that there were many organizations who couldn't get in. We said, we can never get funding, we can never get funding. And when we looked at our data, we certainly had organizations that we internally called frequent flyers. So they benefited greatly from the current system, relationships that they had with our staff. And that was great for them. So post the strategy shift, we were really thrilled because there were many organizations that in the shift got funded for the first time and had never been able to get funding before, and that was great. We hope that's because we were more accessible in our approach and fair. But for those who had previously felt entitled and who no longer fit the priorities, they continue to fiercely oppose the change. And oftentimes it's personal. Personal to me, personal to others on our team. And this goes back to the first point on that leadership piece, is that you do have to have thick skin when you're undergoing a major change initiative. It's a hard thing in any disruption, right? And at OTF, we had to clarify for those that no longer fit, it wasn't because they were doing work that wasn't important. Many of them were. I need to say that. There's people that we used to fund that we don't fund anymore, and not because their work doesn't matter, and not because it's not great and valuable and needed, but when you focus, you have to exclude things. And so that's sort of the message. In leading changes that need to be both gentle and tough in dealing with those whose fortunes have shifted. You need to be open to hearing concerns, but remain steadfast on what you're trying to solve for. Taking a new strategy is about having choices for maximum impact. And so while there may be many beneficiaries in a new model, there will be those who are advantaged by the status quo and will fight to keep it. Which takes me to my final and most cherished reflection. And that is that achieving impact is rarely linear. I was at a meeting of funders on social innovation in New York earlier this year. And one of the participants, I wish I could remember, I wrote down the phrase, but I didn't write down who said it. But I really found it resonated with me. And she said, have a vision, but hold it lightly. Leaders in disruptive change need to be comfortable with the unknown and with ambiguity. Now, I don't normally find myself quoting Donald Rumsfeld in this space, but it seems really fitting in this case. You remember it was the big joke, and he said, there are known knowns, and then there are things we know that we know. There are known unknowns, the things that we know that we don't know. And then there's the unknown unknowns, the things that we don't even know we don't know. Well, that's what change is about. When we launched the implementation of our strategy in 2015, we had an internal mantra that we kept saying, no major foul-ups. Those were approximately the words that we used. But we recognized we needed to learn and evolve, and that we were not going to get it perfect right from the start, right? Let's just take that off the table. Perfection is not our aim. And in fact, just yesterday, we did another announcement that communicated the next iteration and hopefully improvements of our strategy, because we continue to hear feedback and to iterate and to learn and to adapt. We want to make sure we're doing better in our ability to define the problem and find the creative solution. And at OTF, one of the things that I think I brought into the organization was the GEPO principle, which for those of you who don't know is the good enough push on principle. Now, I'm a pragmatist, so that resonates with me very, very well. But for people who are perfectionists, this drives them crazy. Is that you? Fabulous. Okay. So some people think that change is linear, right? They can imagine this, okay, there's this XY axis, there's a graph, there's a 45-degree line that goes diagonally up, and that's what change looks like. I have always found that it's more like that tangle of wires that I have behind my desk that combine my phone and computer and printer and everything else. Everything works, but I can't ever find the start and end to any of those cords, and I don't dare touch it, right? The good news is, though, that you can actually get better with change and with ambiguity and complexity the more you do it. I've been involved with mergers and integrations, with changing funding formulas, with overhauling strategy. And what I've learned that there is considerable effort to keep teams engaged and focused and united through what can be a long and arduous journey of change. I mean, it takes years to get this stuff right. And fatigue can set in, and people can turn against each other. Organization can become too inwardly focused, and they could lose sight of the vision that you're trying to create. And as a change leader, your role is to continually rally the troops. Your role is to be the playground monitor, to relentlessly remind people of the final destination or the ends that's going to make it all worthwhile. It is personally exhausting, but it's also the most satisfying work I have ever done. So I'll conclude. One of the best things about my job is that I get to regularly see people and projects that are disrupting and changing the world for the better. And I feel fortunate to know them and to see their work. Much of it has influenced my own thinking and my own ambitions. My best advice about leading change in disruptive times is to start. Don't succumb to this analysis paralysis or to the perfection. Accept it's messy, challenging, imperfect, and yet absolutely essential. No transformation or disruption I've been privileged to be involved with has been perfect, at least not yet. At OTF, we have transformed our organization within a time frame that many thought was crazy. There are many debates on the board and among staff and leadership about the capacity of our organization to take on everything at once. Why aren't we doing pilots? Why don't we tweak? Why don't we do that? Which is more typical, particularly in our sector. And I'm going to end with a quote by Steve Jobs, who is kind of my guru, although I'm glad I never had to work for him or be married to him. He said, "I have a great respect for incremental improvement, and I've done that sort of thing in my life, but I've always been attracted to the more revolutionary changes. I don't know why, because they're harder. They're much more stressful emotionally, and you usually go through a period where everybody tells you that you've completely failed." So thank you very much for your time and attention. I look very forward to continuing the conversation.